In our morning rounds, a surprising new study finds first-time mothers may be able to safely shorten their pregnancies to avoid complications. The study in the New England Journal of Medicine found inducing labor at 39 weeks resulted in fewer C-sections compared to waiting for labor to begin naturally at 40 weeks. This contradicts a long-held belief that inducing labor leads to more complications, including C-sections. A typical pregnancy, as we mentioned, is 40 weeks. Researchers also found inducing labor did not increase breathing problems in babies, and it lowered mothers' risk of high blood pressure disorders. Our Dr. Narula joins us at the table. Tara, I was quite surprised by reading this. One expert said this could be a game changer. Is this going to be the new normal going forward?
Well, I think it's going to be an option for sure. And as you mentioned, in the past, if a woman went to her OB and said, you know what, can I have my labor induced early? The answer would have been, for most of them, no. Let's wait until you spontaneously go into labor, because there really was this belief that it might increase C-section rates and increase complications to the baby and the mom. And so the fact, though, is that about 1 out of 4 women end up having an induction of labor. So researchers really wanted to know, what are the consequences to the mom and the baby? So they took 2 groups of women. These were low-risk women, first-time moms, and one group they induced early at 39 weeks. The other group they allowed to progress as they normally would to spontaneous delivery. And what they in fact found was surprising, that the induced group at 39 weeks had lower C-section rates, had lower rates of hypertensive complications, lower rates of postpartum infection, less labor pain. And when they looked at the babies, because that's important too, there was really no difference in terms of negative outcomes or consequences to the babies.
Really like that less labor pain part, because that pain is
been there.
Yes.
But what is the magic number of 39?
So 39 weeks is essentially considered full term. And so after that point, really the benefit of having the baby in longer is really not considered significant. And the lowest fetal mortality is at 39 weeks. So that's why that really was chosen as the number.
And we've seen more and more women have C-sections in this country,
yes,
whether it's elective or their doctor's telling them that they need to because the baby's in distress. Could we actually see that number lower? And what is doctors' reaction to this?
We could. And right now, really, it's about 30%, the C-section rate. That's very high. It should be almost half of that. And, you know, the issue about why C-sections might be lower in the early induced group, we think could be a couple things that are going on. One, the longer the baby's in, the fetal size is bigger. That could lead to more C-sections. Also, the placenta may not work as well, and that makes it harder for the baby, the fetus, to tolerate labor. And then the longer you're pregnant, the more risk the mom is for maternal medical complications and also OB complications. So certainly, you know, it makes sense that you might have a lower C-section rate if you deliver somebody earlier. And C-sections come with issues.
Yeah.
You know, it is a surgery. There's risks of bleeding. There's risks of blood clot, infection, scarring to the uterus, so that in your next pregnancy, the placenta might implant in an abnormal location, injury to the bowel and the bladder, hysterectomy, and the list goes on and on.
Yeah.
Not to mention that you have to stay in the hospital longer.
So if you're pregnant right now, you might want to call your doctor.
Yeah.
Certainly, it's worth a discussion. I think that's what ACOG and the Society for Maternal Fetal Medicine are saying, that, look, based on this study, which they reviewed, it's a reasonable option for low-risk women to discuss this with their doctor and have really a patient-centered approach of shared decision-making.
Always good to have you here, Dr. Narula. Thank you very much.